It takes a commitment to fitness and changing eating habits to create a lifestyle change. Fort Wayne's smallest winner is changing lives in our community.
Welcome to Fort Wayne's Smallest Winner. I am Kent Horman. This is our second installment of Fort Wayne's Smallest Winner to talk about the campaign where truly some courageous local citizens are fighting a battle, a courageous battle indeed, to improve their health through a rather competitive but yet healthy program to lose an awful lot of weight. It's a challenge, but it's also a lot of fun. We begin this installment with our first segment with Dr. Daniel Roth for the Centers for Pain Relief. And Dr. Roth, you were on the program about a month ago, and we were talking about the relationship between being severely overweight, obesity, and especially back pain and the problems with the health of your back. And of course, your back is almost the core to your whole system.
That's right, Kent. Thanks for having me back. Today I wanted to come in and be able to talk to everyone about low back pain and how obesity affects the back pain. So to do that, we have a few props, if you will, a few visual aids to help everyone out. And we're going to discuss a little bit about obesity, a little about the spine, how it changes the architecture of the spine, and how that changes the spine in terms of the way that degenerative arthritis kind of develops and forms and becomes worse. So if we could go to that first slide, I'll get the audience oriented to the visuals of the spine. So if you look at that first slide, you'll notice that to the left of your screen, you see a pictorial of the entire spine, cervical spine, thoracic spine, and lumbar spine. Lumbar spine is the lowest part, down colored in orange, and we'll talk a lot about the degeneration of that area of the spine and what occurs. To the right of that is simply an MRI of our normal spine. The kind of squared off light areas directly in the middle are the vertebral bodies, or those are the bones in the low back. The kind of oval looking, darker on the outside, lighter on the inside areas are the actual discs themselves. And so looking at this picture, you'll be able to see those things there. There are other things in the back that can cause back pain, specifically with obesity, and we'll look at those as well. If you move forward to the second slide, this I think gives the audience a little bit of information about what some of these things look like. Everybody always talks about, I see them in my office, well, I have a bad disc, I have a herniated disc, I have a bulging disc, and nobody kind of really knows exactly what's going on with that. So if you look at that there again, you can see the tan-colored vertebral bodies and then the oval discs in the middle. Up at the top of that slide on the left, you see the normal disc, just kind of normal looking. Below that's where we kind of start with disc degeneration. That's the degenerated disc. The one below that is a bulging disc. A degenerative disc and a bulging disc don't necessarily cause too many different problems between the two. Once you move down to a herniated disc, that's when you're going to have low back pain, and typically that's when people start getting that pain that shoots down into the leg. Obesity and chronic obesity, or being overweight for long periods of time, specifically will propitiate these problems and make these problems a little bit worse. As you move down to the disc below, you'll see that disc has thinned out severely. That's kind of a long way through that degenerative process. And then all the way at the bottom is when the disease gets severe and you've got the arthritis. To the right, just to kind of point this out, there are little joints highlighted with red. Those are called facet joints, and those can be pain generators as well. So if we can come back and take a look at the spine model here, we'll go through a few things in terms of the low back pain and how this causes the problems. And looking at the spine here, with the two slides we just showed, you can see that we have discs, we have nerves coming out here, and then we have those joints in this area. On top of that, if we go all the way down to the bottom of the spine, we have things called, to each side here, called the sacroiliac joint. When patients are obese, if you can kind of just imagine this, when you get all the way up front, specifically with truncal obesity in the stomach, you get this kind of extension here, okay? And this extension in this position, along with doing other activities and over time, causes these joints in the back here to become painful, arthritic. You tend to have more weight, more load through that area. Additionally, when that occurs, and this area tends to take on more problems in terms of the arthritis, these two lower joints down here can become painful as well. These, again, are called the sacroiliac joints. On top of that, with the discs that we discussed earlier, then those discs becoming degenerated can also lead to pain as well. And all this together, the discs, the nerves becoming irritated from the discs becoming degenerated, and these joints here along with these other joints lower, give us a multitude of pain generators in the low back. And so what we have to think about and what we have to consider here when we're talking about obesity and we're talking about back pain and we're talking about treatment is, okay, that's what's kind of going on in a 3-minute nutshell in the spine. Well, what are we going to do to make that better? How are we going to treat that? How are we going to get people better? First and foremost, weight loss. Weight loss, weight loss, weight loss. And myself included, I could stand to lose a few pounds. I mean, most people here could stand to lose a few pounds, but doing that is going to help take the load off of this low back, okay? The second thing, on top of the weight loss and the diet, because diets as well, poor diets and diets, especially in this population today, and our nutritionists talk about this, can lead to inflammation. So high saturated fats in the diet lead to inflammation. That causes problems as well. So changing those two things are most important. After the diet, we work into things like physical therapy because we want to strengthen kind of the core musculature in this area. We want the spine to be able to move in better ranges of motion. And then moving from that step, in treating patients, something like an oral anti-inflammatory or something like that are going to be beneficial. That's kind of where we start. In patients who are refractory to that sort of a treatment, then we'll move into other things a little more aggressive but still minimally invasive, things like epidural injections into these joints in the low back where we put some steroid medication in there. And that tends to be very, very helpful in terms of relieving the pain in those locations and allowing people to participate in physical therapy, allowing them to lose the weight.
Obviously, great education on what happens as far as the stress that weight puts on there. And Dr. Roth, some great advice as well. Thank you so much for taking the time to join us here on The Smallest Winner. And again, anybody who would like more information about this particular situation, you can visit Centers for Pain Relief. We can put up the website, centersforpainrelief.com. Also, you can call Centers for Pain Relief at 969-6200. Dr. Daniel Roth from the Centers for Pain Relief. We'll be back with more on Fort Wayne's Smallest Winner after we take this break. Stay with us.